Good morning, I'm Rose Lee. Today we'll focus on important lifestyle tips to help fight off illness and support our immune health. We'll discuss the widespread threat of peanut allergies on our children and why it's time to see your doctor, all when we return. Why has a number of school-age kids with peanut allergies doubled in the past decade? Scientists have yet to identify exactly why the pea plant peanut can be such a threat, or why the allergy has become so widespread. Peanut allergy is one of the most common food allergies affecting more children today than ever before. Most of us don't realize it's a challenge to avoid eating peanuts because foods may be contaminated with the residue of peanuts during processing of food products manufacturing. In fact, nearly 1 in 5 peanut allergic children in the U.S. visit the emergency room following an allergic reaction to peanuts. Joining us this morning is Dr. Christine Chacho from the University of Chicago's Medical Center to share important information about peanut allergies. First, FDA-approved treatment for mitigation of allergic reactions, including anaphylaxis, that may occur with accidental exposure to a peanut. Good morning, doctor.
Good morning.
How many people suffer from peanut allergies, and why is it so dangerous?
So approximately 1.6 million children in the United States currently have a peanut allergy. And for these kids, if they accidentally eat just one bite of a food that contains peanut, it can lead to a potentially fatal reaction.
The problem is those who have the life-threatening reaction don't even know they have a peanut allergy.
Yeah, that's right. It can absolutely be the first time they eat peanut, they have a reaction without ever knowing before.
Well, I know I don't have a peanut allergy because I love eating peanuts. All right, so how has peanut allergies been treated in the past?
Yeah, that's a great question. So until 2020, we have had no treatments for food allergy or peanut allergy. We've told families after they're diagnosed to just be careful to become label readers, to strictly avoid all foods that contain peanut, and be prepared in case there is an allergic reaction to treat them with an epinephrine autoinjector, which you probably know is a life-saving device. But, you know, peanut allergy has been on the rise for several decades. We don't know exactly why, so we're just really thrilled to have this new therapy come to market.
So have you heard of the theory peanut allergies can be related to children with overactive immune systems?
Yeah, so one theory that is being investigated is that if you, over the course of several decades, we have just changed the good bacteria in our environments and on our body, and these good bacteria control the immune system, or it kind of keeps it damped down a little bit, and maybe it keeps it in a place where it would not be interested in reacting to what should be a safe food like peanut. We don't know the exact cause. It's something we're intensely investigating, and we certainly hope to have more answers so we can find more therapies for peanut allergy, potentially even a cure someday.
I thought this is an interesting theory. Being one of 6 siblings raised in an Italian-American home with a lot of snacks, and none of us ever had any issues with peanuts. And as the years go by, this has popped up as a large health issue. And why is that?
That's exactly correct. The incidence has been on the rise for the past 3 decades, and we don't know exactly why, but you're right. It may be that decades ago in bigger families that we were exposed to different and more bacteria, and that may have changed things. But you're certainly right. It's become a huge burden in the United States. It leaves a lot of anxiety for sufferers, and certainly we all have to be very, very careful when we're bringing food to an event now, just to make sure we don't accidentally trigger a reaction that could be life-threatening.
So, doctor, the good news is there's a new treatment option available for children and teens with peanut allergies. So tell us about this new treatment.
So the new treatment is called Palforzia, and I've had the pleasure of working with the company that makes Palforzia for many years, both as an investigator who worked on bringing this drug to fruition, and as an advisor. They're not paying me for speaking with you today, but it is a really neat therapy. It's the first time we've had anything to offer kids with peanut allergy. And what we're doing is we're giving them a teeny tiny dose of peanut below the level that would cause an allergic reaction. But over time, we slowly eke it up. And what we're doing is we're tricking the immune system into learning how to tolerate it. We can get kids to a point where they're eating 1 peanut's worth of peanut protein every single day. And by doing so, we make them bite safe. So if they accidentally ate a bite of a food that contained peanut, they'd be unlikely to have a severe allergic reaction afterward.
Doctor, I appreciate you explaining the process because it's a lengthy process of getting a new drug treatment through the Federal Drug Administration because it's a massive accomplishment.
That's right. That's exactly right. It's very exciting for all of us.
So you're using this as a measured study as well as a finished product that's approved by the FDA. Will these children grow out of this allergy as they grow up and get older?
Yeah, we just don't have the data yet. We've been following these kids for several years, but we have many more years to follow them to find out what happens. We're advising families to go into this therapy still expecting the peanut allergy to be lifelong. It's not a cure. We don't tell them to expect that they could suddenly start eating a peanut butter and jelly sandwich, but we're really hoping to reduce the anxiety in the family and increase that quality of life just by giving them that bite safe. But of course, we have much more research to do. We have to see what happens in the long term if we can even modulate the immune system even more to have even a bigger, more beneficial effect, and to see if this can work in other age groups as well.
So who is considered a candidate for this treatment?
Currently FDA approved for kids ages 4 through 17, and now may be a great time to think about it or speak to your allergist about this therapy to see if it's right for you. As you mentioned before, we're in a unique time. A lot of kids are e-learning or they are in a hybrid model. There's more flexibility in our schedules than there's been in years. It does take quite a bit of monitoring to successfully complete this therapy on behalf of the family. And now where kids are home, so it may be more practical to get that time built into the schedule for this therapy.
All right, doctor, tell us where our viewers can find more information to address a peanut allergy.
I would recommend first talking to your allergist, and if your allergist is not yet familiar with Palforzia, they can go to a new website, www.palforziarems.com. That's Palforzia, REMS.com. And they can find a provider in their area through this website that they can make an appointment with to discuss further.
Thank you, doctor, for sharing information on the new FDA-approved first oral immunotherapy to fight the accidental exposure to peanuts in patients 4 to 17 years old.
You too.
We love Florida activities with friends and families, but one thing is for sure, we will all bring home germs and illnesses that we share with our friends and our playmates. So germs are everywhere. Even for playing in our backyard with friends and pets, we bring home those nasty germs into our household. So how can we avoid spreading disease? Michelle Helavasa is an epidemiologist at the Center for Disease Control with helpful reminders to keep us from stop spreading disease.
Hand washing is one of the most important ways you can keep from getting sick and spreading germs to others. Dirty hands spread disease. This hand washing demonstration will show you how hand washing can get rid of germs and chemicals that get on our hands every day. This gel is like the germs and chemicals that we get from things we touch throughout the day, like our toys and pets. If we then rub our eyes, nose, or mouth, or pick up something to eat, the germs or chemicals can get into our bodies and make us sick. Studies have shown that people touch their eyes, nose, and mouth about 25 times every hour without even realizing it. To get rid of these germs and chemicals, CDC recommends you follow these easy steps every time you wash your hands. Wet, lather, scrub, rinse, and dry. We're going to show you the right way to do each step. First, wet your hands with clean running water. Turn off the tap and apply soap. Then, lather your hands by rubbing them together with the soap. Be sure to lather the backs of your hands between your fingers and under your nails. Scrub your hands for at least 20 seconds. If you don't have a clock nearby, keep scrubbing until you've sung the happy birthday song twice. Rinse your hands well under clean running water. Dry your hands using a clean towel, electric hand dryer, or air dry them. Washing your hands using the steps we just demonstrated is very important to get hands completely clean. Let's see how well we got rid of the germs and chemicals. Great. No more germs and chemicals. Why is this so important? Germs and chemicals from unwashed hands can get into our foods and drinks when they're being prepared or when we're eating or drinking them, which can make us sick. Also, germs and chemicals from unwashed hands can be transferred to other objects like cell phones, tabletops, or toys, and then transferred to other people's hands. That's why it's so important to wash your hands following these steps. Wet, lather, scrub, rinse, and dry, so you can stay healthy and help keep those around you healthy.
For more information, visit cdc.gov/hand washing. On average, more than 35 million Americans come down with the flu each year. According to the Center for Disease Control, influenza flu is a contagious respiratory illness caused by influenza viruses. It can be anywhere from mild to severe, and it can also result in hospitalization or death. This year's cold and flu season may be particularly challenging and could shape up to be a serious health concern for many people. Joining us this morning is registered dietitian Pam Nisevich-Bede to share important lifestyle tips to help fight off illness and support our immune health. Good morning, Pam.
Hi, thank you for having me on.
My pleasure. Our immune system works to recognize and identify an infection or bodily injury in order to ignite the immune response and restore the immune system back to its normal function. So what challenges and nutrients can people add to their diet to support their immune health?
Our immune health is a very complex topic, right? And our immune system is a very hardworking system. But there's a lot we can do with diet and exercise to make sure we're, putting our best foot forward. And I'm here today with my colleagues at Abbott, where we believe your best health can start with your best nutrition. And as a registered dietitian, I believe and I know that a nutrient-dense plate is one of the best tools we have. And nutrition and eating for immunity, it sounds complex and intimidating, but it doesn't have to be. It is as simple as prioritizing protein, eating the rainbow to get in vitamins A, C, D, E, and zinc. Here's what that might look like on your plate. So you could start your day with eggs, which are a great source of protein and zinc. Throughout the day, think through some of these really deeply colored fruits and vegetables. So broccoli, sweet potato for vitamin A, mushrooms for vitamin D. When you're snacking, make it purposeful. So grab citrus fruit for vitamin C, nuts for vitamin E. Throughout the day, these nutrients work hand in hand to support our immune health.
Pam, I take a number of vitamin supplements each day for many decades. So how does that protect me from catching a virus? And if our viewers are watching this and are considering adding a nutritional supplement to their diet, what do you recommend for them to stay strong and prevent catching a common cold or a flu virus?
Well, research tells us that many Americans our intake of immune boosting nutrients is too low. And in a perfect world, we would walk around with our nutrient-dense plate, take it everywhere we go. But real life happens. I know personally, I'm juggling a lot, and making a really nutrient-dense diet come to life is a real challenge. And that's where nutrition shakes come in. They fill in those nutrient gaps that most of us have in our diet. For me, that's grabbing one of Abbott's Ensure Max protein, 30 grams of high-quality protein for strength and energy, 25 vitamins and minerals, many of which are those immune-supporting nutrients that we just spoke about. Or if you're following a plant-based diet, vegetarian, you're vegan, we have, Ensure plant-based protein shakes as well. And these nutrient supplements used throughout the day for snacks, for when you're on a go, can help really round out your diet.
So why is hydration so important to keep us healthy, and how much water should we drink each day to help us rehydrate if we get sick?
Another great tool that we have to support our immune health is hydration, because 70% of our body is made up of water. We want to maintain that hydration because that also helps maintain our mucous membranes. It helps immune cells get where they need to go to fight off infection. And when we are ill, when we've got fever, cough, vomiting, we are at risk for dehydration. And so throughout the day, sip on calorie-free beverages like water, add in electrolytes. You need an optimal blend of electrolytes, and that's why my go-to is always Pedialyte, because of that optimal blend of electrolytes, a little bit of sugar for rapid rehydration. I get that question a lot about how much water should I personally drink? And it's hard to make a blanket recommendation, but most of us, as long as we're sipping on beverages throughout the day, we're adding in electrolytes, and then also our urine is running a light lemonade color, we are in a good place for hydration.
Here in South Florida, we are blessed with beautiful weather to keep us active. And I advocate for everyone to get active, even something as simple as taking a walk every day after dinner, to help us stay healthy and feel better.
Any amount of exercise we can add in throughout the day, anything we can do to add to what we're doing right now is going to be beneficial. Exercise is one of the best tools we have for immune health. It improves circulation. Circulation gets those immune cells where they need to go. There is a direct link between muscle health and immune health. So you are absolutely right to encourage people to get out there and to get moving, to find an activity that works for you and works for your schedule and your fitness level. Most important thing is that we're all finding activity.
Now, how about physical activities for seniors with mobility issues? How can we help them increase their activities just around the house?
Many of us have tools in our own households that we don't realize can help us with activity. So sometimes it's strength training, which sounds intimidating, but using our own body weight, right? Maybe you can't do planks or you don't feel like doing squats, but can you use some cans of soup for, arm raises? Can you just take more steps throughout the day? For some of us, that's enough. Just going from sitting to moving more. Think through what you're doing right now and just add to it. And again, don't let it be intimidating. Don't let, the thought of having to get out into the gym, derail all your efforts. Start with where you're at and add a little bit.
So Pam, where can our viewers find more information to stay healthy before the flu season hits?
You can always visit us at Ensure.com, and you can always find Ensure at all major retailers and Amazon.
Thank you so much, Pam, for joining us this morning with tips to support our immune health to fight the flu.
Thank you for having me.
According to the National Center for Health Statistics and the Census Bureau, 40% of adults in the U.S. have put off going to see the doctor. And a new report from the Center for Disease Control confirms it. People are delaying doctor visits for fear of contracting COVID. This is creating a serious health impact on people with chronic conditions. Joining us this morning to discuss the report and how to safely visit your doctor is Dr. Kenneth Adams, Regional Chief Medical Officer of United Healthcare, Medicare, and Retirement Plan. Good morning, Doctor.
Good morning. How are you this morning?
I'm feeling great, thank you. So, Doctor, share some of the key findings from the CDC report.
I think the most significant finding from that report is that if you have a chronic condition like obesity, lung disease, diabetes, or cardiac disease, you are 12 times more likely to die because you're not going to see your physician for their routine follow-up visits.
Doctor, I also read new research reporting deaths are increasing from heart disease, stroke, and diabetes as emergency room visits for those conditions are down. Some refuse to even see their doctor and have an annual checkup with blood work to ensure they're in good health or even monitor their chronic health conditions, all due to the concern of catching COVID. So when do you know it's the right time to see your doctor?
If you have one of those chronic conditions, you should be having routine follow-up visits anyway. So if you don't, then an annual visit is probably sufficient.
Okay, doctor, so let's talk about the decrease of annual visits here in South Florida. So how can you provide that safety net for patients from the practitioner once the patients are in the clinic?
So physicians as a whole, all the offices are following strict guidelines with masks, with social distancing, with frequent cleaning. So if you're wearing a mask to go into that office, your risk of contracting COVID is very low. There are other things that our physician offices are doing, like curbside visits, which are really neat. You show up at your doctor's office, you call in, they send a nurse out to check you in, and then the physician can come see you in your car. Thirdly, the opportunity for televisits is something that has come out of COVID-19, and it's a wonderful thing. They're easy, they're convenient, and people should be engaging in those types of interactions with their clinics, their primary care physicians' offices.
When you schedule a telemedicine visit, how do you monitor the patient? Do you schedule an in-person follow-up?
It all depends on what you're being called or what the telemedicine visit is concerning. I had a migraine that necessitated medication, and the physician wanted to just see how I was doing on my new medication. So there's no follow-up visit from that because I was doing fine. But maybe you are complaining of something that does require some blood work or does require you to come into the physician's office. They can determine those things on the telemedicine visits. But about 60 or 70% of physician office visits can be handled just with a telemedicine visit and not an in-person visit.
That still keeps the patient out of the office. Shouldn't they schedule an annual checkup and blood work?
Absolutely. Cancer doesn't know that COVID-19 is out there right now, so cancer is still an issue. And we continue to, as you age, your risk for developing certain cancers increases. So it's really important to go in and see your primary care physician for colonoscopies, for breast cancer screening, for all those kinds of things that we did before COVID-19 existed.
Another concern is colonoscopy. It's necessary after a certain age. That's like every 5 years, correct?
Well, it depends. I'm 48 years old and I've already had two because I had a mother who passed away from colon cancer in her 60s. So it all depends on your risk profile. And it also depends on what they find during the first colonoscopy. So if you have polyps or some indication of precancerous lesions, every 5 years is insufficient, and it may be every year for a while. But it's totally dependent on you as an individual and what your risk factors are.
Doctor, what other issues patients may be experiencing due to COVID?
Well, so I think depression is one thing that's affecting a lot of patients right now. And telemedicine visits are amazing. We are having patients come in that wouldn't have come in otherwise, and people are responding in a much different way to telemedicine visits. I think part of that is that you don't have to go to an office and sit in a waiting room and worry about running into your next door neighbor who's going to ask, why are you here at the psychiatrist's office? So depression is definitely something that is benefiting from telemedicine visits and something that we see as a chronic condition that people need to address.
Not only mental depression, the lack of activities.
That's what people need to be doing. The risk of contracting COVID when you're outside, especially if you're 6 feet away from somebody, is very low. So I would encourage people to go out and to continue to get exercise. And if you haven't been getting exercise in the past, to use this as an opportunity. I know at the very beginning of COVID, it was great to see people outside taking walks with their dogs and families. I mean, I know the dogs loved it. They were getting walked multiple times a day. So please take advantage of that.
Just get out and go for a walk or play around the house. All right, doctors, tell us, where can our viewers learn more about getting in to see your doctor?
I'm just going to reiterate, I think you need to go in and have your primary care visits as routinely scheduled, and to go out to our website, wellmedhealthcare.com/see-your-doctor to learn more information.
Thank you, Dr. Adams, for creating awareness of safely seeing your doctor to ensure quality care to keep us healthy.
Thank you.
Fall is here and flu season is following, so make time now to schedule your annual checkup with your doctor. Eat balanced meals filled with protein and vitamins to support your immune health to fight off any illness. Now share with us your plan to support your immune health at facebook.com/Rose Lee Show and follow us on Instagram at The Rose Lee Show. Watch this episode and others 24/7 at RoselyArcherShow.com. Thanks so much for joining us this morning, and we look forward to seeing you soon.